Boston. Older patients with diabetes may be at an 84% higher risk of developing postoperative cognitive dysfunction (POCD) than those who are not diabetic, suggests new research being presented at the Anesthesiology 2017 annual meeting. With POCD, a patient's mental ability declines after surgery, compared to their cognitive performance before surgery, resulting not only in increased complications and potential death but also impairing the patient's quality of life, said Gunnar Lockman, MD, Department of Anesthesiology and Operative Intensive Care Medicine, chair at the Universitätsmedizin Berlin, in Germany. POCD is increasingly recognized as a common complication after major surgery, affecting 10 to 13% of patients, with seniors being especially vulnerable. POCD is a major form of cognitive disturbance that can occur after anesthesia and surgery, but little is known about its potential risk factors. An association between diabetes and age-related cognitive impairment is well established, but the role diabetes has in the development of POCD is unknown. In the study, researchers performed a secondary analysis of 3 studies, comprising a total of 1,034 patients, 481 who had cardiac surgery, and 553 who had non-cardiac surgery, to examine whether diabetes was a risk factor for POCD. The mean age for the patients studied was 66.4 years. Of the 1,034 patients studied, 18.6% had diabetes. The association of diabetes with risk of POCD was determined using logistic regression models at the longest patient follow-up period for each study, which was 3 or 12 months. Risk estimates were pooled across all 3 studies. After adjusting for age, sex, surgery type, randomization, obesity and hypertension, the researchers determined diabetes was associated with an 84% higher risk of POCD. Patients age 65 or older were at particularly high risk. Our findings suggest that consideration of diabetes status may be helpful for the assessment of POCD risk among patients undergoing surgery, said Dr. Lockman. Further studies are warranted to examine the potential mechanisms of this association, to ultimately help in the development of potential strategies for prevention. In 2015, the American Society of Anesthesiologists (ASA) launched a new patient safety initiative, the Brain Health Initiative, to arm physician anesthesiologists and other clinicians involved in perioperative care, as well as patients and their families caring for older surgical patients, with the tools and resources necessary to optimize the cognitive recovery and perioperative experience for adults 65 years and older undergoing surgery. Learn more at asaahq.org. Brain Health Initiative. The American Society of Anesthesiologists, founded in 1905, the American Society of Anesthesiologists (ASA) is an educational, research and scientific society with more than 52,000 members organized to raise and maintain the standards of the medical practice of anesthesiology. ASA is committed to ensuring physician anesthesiologists evaluate and supervise the medical care of patients before, during and after surgery to provide the highest quality and safest care every patient deserves. For more information on the field of anesthesiology, visit the American Society of Anesthesiologists online at asaahq.org. To learn more about the role physician anesthesiologists play in ensuring patient safety, visit asaahq.org when seconds count. Join the Anesthesiology 2017 social conversation today. Like ASA on Facebook, follow ASA Lifeline on Twitter and use the hashtag ANES17. Disclaimer: AAAS and Eureka Alert are not responsible for the accuracy of news releases posted to Eureka Alert by contributing institutions or for the use of any information through the Eureka Alert system.